New Zealand's public health system is currently facing one of its most serious challenges in decades. Hospitals nationwide are struggling with immense pressure, impacting both patients and frontline staff. The core issues include severe staff shortages, rising patient demand, and increasingly long waiting lists across the country. Emergency departments are on the front lines of this crisis, frequently operating beyond capacity. Wellington Regional Hospital in particular has repeatedly entered, quote, code red status when demand far exceeded available staff and beds. Patients describe overcrowded corridors and extremely long waits, sometimes exceeding 8 hours without being seen. These incidents are not isolated. They point to deeper systemic capacity failures within the health system. One reported case involved a woman waiting over 11 hours in severe pain at Wellington ED before leaving untreated, as no beds were available. The crisis extends regionally. For example, a Kenepuru Hospital urgent care clinic was left without a doctor, and nurse-led clinics closed overnight in Napier due to staffing gaps. The pressures are severely impacting planned care, leading to significant surgical delays and growing waiting lists. In Tauranga, one patient waited over a week for urgent gallbladder surgery, facing daily postponements due to capacity constraints. Nationally, over 200,000 people are waiting for a first specialist appointment, with many facing long waits that worsen their conditions. Critics argue that focusing on individual hospital performance overlooks deeper, structural problems in funding and workforce planning. Despite increased health spending, it has reportedly not kept pace with inflation, population growth, and the rising demand for services. Furthermore, thousands of health sector roles have been cut or left unfilled, and less than half of newly qualified nurses secured jobs recently, raising serious workforce planning questions. To tackle backlogs, the government has expanded the use of private providers for elective surgeries. Thousands of procedures have been outsourced to private contractors under long-term agreements to reduce public waiting lists. Critics warn that this risks weakening the public system by diverting staff and resources, potentially creating a two-tier system based on ability to pay. Health experts agree that this crisis is the result of years of cumulative challenges, not an overnight phenomenon. Underinvestment, repeated restructures, and difficulty retaining skilled staff have all significantly contributed to the current strain. Frontline workers emphasize that sustained investment and realistic workforce planning are crucial to ensure timely care is available when needed.